Hello, and welcome to this session on making our indoor spaces safer during COVID-19. This is a topic of ongoing interest for people around the world, in particular in the northern parts of the planet. As it becomes colder and we head indoors, we have to think more carefully about the choices we make of how and when we meet, and how to make those indoor spaces safer. To respond to the COVID-19 pandemic, WHO works with a range of experts in a variety of professions, including architecture and engineering. If you saw, we did a live session last week with an architect and engineer in around a hospital in Italy that WHO is supporting so they can make that space safer for the patients, the visitors, and the health workers as well. Today, we are joined by Dr. Maria Nera, the Director of the Department of Environment, Climate Change and Health, and Luca Fontana, Water, Sanitation and Infection Prevention and Control Specialist, consultant with us. He's a WASH IPC specialist, if you like acronyms. My name is Nika Alexander, and I'm part of the communications team here. To ask questions, because this is a live session, use hashtag AskWHO on Twitter, and in the comments section, drop your question in the comments section of Facebook, LinkedIn, and YouTube. We're going to start with Dr. Maria Nera. Dr. Nera, can you tell us a little bit more about how and why WHO works with those people from other sectors and other types of experts that aren't just strictly in health?
Yes, Nika, actually it's a very common practice for the WHO to work with other sectors, with other experts. Myself, as the director of the Department on Health, Environment and Climate Change, you can imagine that we work with many experts outside the health sector, of course, with the health sector as well. In this case, we have established a group, a control technical group of advisors, an advisory panel, which is called Environment and Engineering. And then we have people from technical experts from different fields. We have architects, we have engineers, we have people from the field of chemistry, we have, of course, public health officers. And the idea is to collect the best of the scientific evidence we have, analyze it, do some interpretation and looking at the risk benefit of some interventions. And with that, being able to provide the best of the technical recommendations. And for that, we are so lucky in WHO that we can call on the best experts around the world. Actually, let me tell you that this is probably one of the most beautiful functions of WHO, the capacity of convening the best experts around the world. And I have to say that they always respond in a very positive way, and they contribute with their knowledge to our work and to respond to the public issues that we want to, for which we want a response.
Thank you, Dr. Nera. So one of those people we are working with now is Mr. Luca Fontana. Luca, can you tell us a little bit more about your background, your experience in ventilation, and then we'll ask you specifically about what ventilation itself means.
Sure. Thanks. So actually, by background, I'm an environmental toxicologist epidemiologist, though I mostly work with architect and engineer, as Dr. Maria Nera was saying. That's what we need to develop guidance, recommendation to better understand and read what is the scientific evidence available today. I've been working for the last 8 years in infectious disease treatment center design and management, always with a multidisciplinary approach involving public health clinicians, anthropologists, nurses, and specialists from the building environment to better design treatment center healthcare facility that were safer for people, for patients, for the staff, and accessible to community as well.
Thank you, Luca. That's exactly the last part you spoke about, making healthcare facilities safer for the staff, the visitors, the patients. That's exactly what our live from last week was about. So if somebody is interested in that, it's probably on the platform you're watching us from now. You can go back and see that one from Friday. So Luca, today we don't want to focus on healthcare facilities. Mostly, we want to focus on the living environment. I think that's what people might like to understand today. But just tell us what we mean when we say ventilation, because it can mean so many different things.
Sure. With ventilation, we intend introduction of fresh air into a space while the stale air is removed. It is done to maintain the quality of air in that space. It moves outdoor air into a building or a room and distributes the air within the building or the room. The general purpose of ventilation in a building is to provide healthy air for breathing by both diluting the pollutants originating in the building and removing the pollutant from the space itself.
And when we're talking now, the pollutant, we would mean virus potentially being in the air or droplets being in the air. And that's what people would want to know, how we remove that. Is that about right?
Yeah, absolutely. When we talk about pollutants, we mean absolutely everything. It's reducing the concentration of a given particle or pathogen, for instance. And yes, ventilation play a key role in making space safer. It's not a standing alone measure. It's part of a broader package, including hand hygiene, social distance, the use of mask as well. But sure, we can say that a well-maintained and operated system can reduce the spread of COVID-19 in indoor space by increasing the rate of air change, reducing the recirculation of air, and increasing the use of outdoor air. Clearly should be adapted, which means recirculation modes should not be used or reduced as much as possible. And in case of air recirculation, filter should be cleaned regularly. Heating and air conditioning system should be regularly inspected, maintained, and cleaned. As already said, by itself, running your ventilation, heating and ventilation system is not enough to protect yourself and your family from COVID-19. However, when used along with other best practice recommended by WHO, operating the heating and ventilation air conditioning system can be part of a plan to protect your family and yourself.
Thank you, Luca. That was a lot of information there, and I'm sure we'll get questions on certain parts of that, so we'll come back. In the meantime, though, if people want to see what we have already written on the website, and often that's translated into other languages as well. We have questions and answers for the general public on ventilation. We have more specific for public spaces and buildings and for health facilities as well. Our colleagues who work in social media will drop those links in for you so you can more easily go to those resources, and that there's summaries of what Luca just said as well. Luca, we've already have some questions on indoor space versus outdoor space. So a colleague is asking, one of our viewers is asking whether if you're in a restaurant, is it safer to eat inside or outside the restaurant?
Okay, clearly outside natural ventilation, it's, always more reliable than an indoor spaces, absolutely. And to make it simple, the more dilution, the safer is the place. Outside space, okay, that can be safer than an indoor space whenever there is natural ventilation, but again, not as standing alone measure. Always bear in mind the social distancing as well.
Yes. So even though you're outside, you don't want to be, half a meter or just a few feet away from someone. It's better to be further. And Luca, thank you so much for your summary as well about there are times when wearing a mask is appropriate, the social distancing and the hand washing as well. Those are all important aspects of it. Maria Nera, I wanted to ask you a little bit more about environmentally friendly solutions for opening up spaces for bringing fresh air in if someone doesn't have an air conditioner, or if you want something that uses less electricity. What are some other options we have during COVID and even normal times, as you said earlier?
Yeah, well, and as you say, we have been working on ventilation for a long time and recommending natural ventilation as one of the most effective measures for renewing fresh air and making sure that we have better conditions. And whenever it's possible, natural ventilation, fresh air, opening the windows, making sure that you renew your fresh air and you ensure that as much as possible. It's not the only measure. You need to accompany with other protective measures that Luca has been describing. And this will be very good, not only for the protection of COVID-19, but any other infectious agents and for health, creating a healthier environment in general. In terms of other, for instance, mechanical fans, those are as well certainly a way to do it. Environmentally friendly will be whenever it's possible. If you have solutions for having solar panels, for instance, or other type of renewable energy that will allow you to maintain electricity, and then having these mechanic funds, for instance, to help you with that. And of course, Nika, one of the most important ones that we are working upstreams now is that we work very much with architects and urban planners and other group of peoples that help us very much on creating the conditions for these healthier environments for people, and looking at the source, at the root causes of the diseases. And in that sense, we are working very much on trying to promote for architects, or when building new, creating new buildings, on this idea of, whenever is possible, natural ventilation. We have buildings now that they are very sophisticated systems. Whenever it's possible, architects and building managers are pushing for this type of structural measures that will be very useful for public health.
Thank you, Dr. Nera. I've heard a few glitches in the audio. I hope you're not having trouble at home as well, but bear with us. Most of the time, it seems pretty clear. We have a question from Facebook from Adel Hamada asking, how do you use, or what about using HEPA filters indoors? That would be a question for you, Luca. And could you start with saying what HEPA filters are?
Sure. I mean, high efficiency particulate filter, can be used in heating and ventilation conditioning system to allow air recirculation, or to properly exhaust exhausted air. So how we can treat potentially contaminate air, filter this air, and either dispose this air outside, exhaust it outside, or recirculate it as well. It can be, they can be used, but they require adapted cleaning and maintenance. So it can be a solution, HEPA filter, and is actually they are actually frequently used for closed environment, a closed space, for air recirculation, transport means like airplane as well. They are high efficiency. They can filter up to 97, 99% of the particle in the air, but they require maintenance and cleaning.
About HEPA filters and how they can keep the air cleaner. It's quite, would suggest colleagues look at our guidance online. There's details about HEPA filters and how and when they can be used. And that may be helpful for you at this point. We also have people asking specifically about just air conditioners. I know that our advice says that air conditioners should be put on the setting where they bring in fresh air from outside and they're not recirculating the air from inside. So that we know already. But how do you check if your air conditioner is doing that? Do all air conditioners have the capacity to just bring in fresh air? Luca, that's another one for you.
Thanks a lot. So there are different types of air conditioning. There are air conditioning that works with outdoor air, bringing out outdoor air inside, diluting the indoor air. And there are others air conditioning system that works with recirculation. Some have HEPA filter, others they don't. It's possible to use air conditioning if needed, if required, but we need to pay attention on which kind of air conditioning we have. So it's one working with the recirculation mode or with outdoor air, if they are equipped with filter, if the filter are well maintained and regularly checked as well. But it's possible, and it's just required to pay attention on the type and the system, and if they're equipped with filter, and or if they use outdoor air.
Do you think this is something that people can do themselves, or is it something that you would advise having an expert or someone who knows more about the equipment come in and check? Because some of it sounds quite technical, and I'm not sure I myself would be able to check on the filtration system of my air conditioner.
Okay, it's something that can be done looking at the technical specification on the air filter and checking the technical specification on the manual itself to see if it's working on a recirculation mode or not. That's possible. Clearly, that's in the private in a private household. When we start talking about workplace, schools, and public space, most of these require a technical expert, HVAC expert, to control and assure proper maintenance of the system.
Dr. Nera, I just wanted to ask you a little bit more. If we're talking about people who live in places where they may not even have electricity, yet at the same time, maybe living very close together. One of the areas of concern for WHO is always people in humanitarian settings, people who've been who are no longer in their homes or living in temporary homes, perhaps in a camp where there's many people together. What can we suggest to people in those conditions during COVID to try to make their environment a little safer?
Yeah, Nika, because in fact, one of the key pillars in terms of public health recommendations for COVID-19 is to wash your hands. And in fact, we have a big proportion of the global population that they cannot do it because simply they don't have access to safe water, sanitation, or soap. So this is one of the things as well that we are trying to push on and scale up interventions to make sure that as a kind of legacy after COVID-19, we will increase dramatically the proportion of people having access to clean water and sanitation and so. Regarding the ventilation, whenever it's possible, obviously activities outdoor to facilitate this, as Luca was saying, reduce this risk of transmission, obviously complemented with other measures, whenever it's possible, again, the social distance, but natural ventilation will be the solution. Or, as I say, there is a way to have access to renewable sources of energy, which are getting cheaper and cheaper, where many international organizations are now facilitating access to those in terms of solar panels, for instance, that can provide the minimum requirements of energy for a healthcare facility to maintain a minimum of ventilation, or the renewable energy coming from wind or other sources. So we need to make sure that as well this access to clean sources of energy at the household level, at the indoor level, is facilitated and scaling up. And for those refugee camps, at least maintaining this natural ventilation whenever it's possible, and keeping all the activities outside, again, whenever it's possible.
Thank you. I'm having a little bit of gaps in audio here. I hope it's okay online. Thank you, Dr. Nera. We have a few questions. I'll put two questions together. People asking about fans. So fans can mean a few different things. It can either mean a ceiling fan or a kind of a desk fan that you might put in front of you or in a window or something. So let's take those apart. A ceiling fan, is a ceiling fan recommended to keep the airflow during COVID?
Okay, I guess that's for me. So if that first one, at home, a table or pedestal fan are safer for air circulation amongst family members living together who are not infected with the virus that caused COVID-19. However, fun should be avoided when people who are not part of the immediate family are visiting, since some people could have the virus despite not having symptoms. Air blowing from an infected person directly at another in a closed space might increase the transmission of the virus from one person to another. At home, office, or school, if the use of table or pedestal fan is unavoidable, it's important to increase the outdoor air change by opening windows, for instance, and minimize the air blowing from one person or a group of person to another person or other group of people.
So to summarize, if you have one of those pedestal fans, one of those fans that will be blowing right around where people's heads are, it's okay if you're in a family or a group of people who are sort of cohorted together, who are always together, who would already be sharing air. But if you're bringing someone new into that group, a visitor, or if you are, say, at work where you are generally able to stay apart from people, you wouldn't want to push the air from one person to another person, because you're taking the droplets basically that are using that air as a medium, and you're making them go from one person to another. Something like that.
Yeah, actually, that was a good resume. And then the second part of your question, I mean, the use of ceiling fan, it can improve circulation of outside air and avoid pocket of stagnant air in occupied space. However, it is critical to maintain good outdoor ventilation when using a ceiling fan, and an efficient way to increase outdoor is exchange by opening the window for the same reason that you just explained.
I just want to read something for those watching. We are asked so often, and we're still trying to really understand, well, how does COVID-19 transmit? So I'm going to read a summary that's the very clear language on how the virus transmits from one person to another. So COVID-19 mainly spreads between people through direct or indirect contact, indirect meaning something like a surface in between you and another person, or close contact with the infected person via mouth and nose secretions. So basically, it's when people are close together and you're talking or laughing. When you speak, small droplets come out of your mouth. They have come from your lungs and could be breathed in by the other person. That's the main way the virus spreads. So these include saliva, respiratory secretions, or secretion droplets. These are released from the mouth or nose when an infected person coughs, sneezes, speaks, or sings. People who are in close contact within 1 meter with an infected person can catch COVID-19 when those droplets get into their nose, mouth, or eyes. People ask us whether or not the virus is airborne. I think sometimes the droplets, big or small, travel through the air, but when technical people are talking about airborne, they mean tiny, tiny droplets and fractions of the virus that may float in the air for a longer period of time and may go over a longer distance and stay in the air for a longer period of time. And that kind of transmission does occur sometimes in very specific settings. And it's actually why we're talking now about ventilation. So those specific settings are sometimes in a healthcare setting. When the healthcare workers have to do some procedures, it can make the virus into smaller particles. And it could also happen when people are in a small space close together that's not very well ventilated for a longer period of time. It's possible through people talking and laughing and singing for a period of time in that setting that there will be more particles in the air. And that's why we talk so much about the importance of being further apart, about making sure the air is fresh and being circulated, new air coming in regularly, and all the other things such as wearing a mask if you're not able to be more than 1 meter apart, washing your hands regularly in case you might have picked up something that had come onto a surface, and avoiding touching your eyes, nose, and mouth with hands that aren't clean. So it's so many different things at the same time. That's why we repeat a lot, because it's actually a lot of detail to remember. And it's a bit of a change in our daily practice as well. I'm just going to check for some more questions online. We have a few questions on UV, on whether you can use various tools, UV lights, to purify surfaces. What does WHO say on that?
Luca, you want to take it?
Yeah, we have considered the UV for surface disinfection and hair scrubbing as well. The problem is that we cannot recommend the UV as a standing alone solution. It should always be partnered with the HEPA filter, HEPA filtration, or different approach, but not as standing alone approach. Has been intensively used in some country since a few years ago, specifically for TB. But right now, though we know that some healthcare facilities are currently using a UV system, we do not recommend it as standing alone system.
So in case anybody has joined us a little bit later, Dr. Nara, can you just remind people again, I've asked you to speak a lot about in the lower resource settings, but for people in general, how do you make the air where you're living or working or eating or shopping, what are ways to make that air fresher, cleaner, and safer?
Thank you, Nika. And once again, this is not just for COVID-19. This is making the air cleaner and safer for any other type of infections. Whenever it's possible, avoid the very crowded and close contact places. And as we have been recommending in the last months already. And natural ventilation will be certainly one of the best ways to create a better indoor quality. Whenever it's possible, open your windows. As I say, we are working now with architects and urban planners to make sure that we design so well at front. When a building will be constructed, when we are planning on a group of houses, now is incorporated more and more this possibility of having natural ventilation. This continues to be one of the best ways to do it. And definitely this is the one we are promoting. For people living in very low resource settings, whenever it's possible as well, using renewable energy to have a minimum, maybe if there is a need to use a mechanical fan, we can use renewable sources of energy. And Luca was describing all the facilities. In case you need to use air conditioning, it has to be well maintained, and whenever it's possible, avoiding those where there is a recirculation of air. And if it's the case, it has to be very well maintained and with the adequate filters. I think we keep all of that, but whenever it's possible, activities outside, and if there are inside, always a very good natural ventilation if possible, and if not, looking for those other ways of making sure that you will have the best conditions and the best quality for the indoor air.
So Dr. Nera, you're actually saying if we're in a space that has windows that can be opened, I know every space varies and windows are different sizes and the breezes are different, but are you saying that in general, if you have a choice between closing the windows and turning on an air conditioner or opening the windows and letting fresh air flow in, that the open window is a better approach?
Yes, and this is in general for any type of, all the recommendations on housing, for instance, for avoiding any other diseases. Whenever it's possible, open the window and make sure that there is natural ventilation, and that will be definitely a very positive way to do. If in those new buildings, sometimes the windows cannot be open, then of course you need to look at other ways to probably there will be an air conditioning and making sure that the conditions for indoor are properly maintained.
We did have a question online about that specifically. In fact, when you're traveling, often the hotels, depending on what hotel you're in, but they will often have, for safety reasons, the windows don't open. So even though you'd love to have a breath of fresh air, that's not how the building is constructed. So we did have a question on that. So when we spoke with the architects and engineers last week in Italy about hospitals, they made the same point as you did, Dr. Nera, that we're using this moment to already think about how we can build in the future, how we can make waiting rooms larger spaces, have the chairs further apart to reduce the chances of infection. And you were mentioning already thinking around how people live and how we can already try to make those spaces healthier. What are some other things that you're working on? You chair a group that works on ventilation, which is, as we can see from today, a really important area. WHO has been talking about this since the very beginning of this outbreak. But what are some of the other issues that people bring to that group that maybe we as healthcare, health focused don't think of ourselves, but the people from the other realms are asking us to think about more?
Exactly, and this is one of the advantages to have this environment and engineering advisory panel with technical people from different fields and specialities. And we are trying to provide recommendations, not just for the healthcare facilities, but outside healthcare facilities, schools. At the moment, people is very much asking questions about the schools. Again, whenever it's possible in schools, ensure natural ventilation. Sometimes for security reasons, the windows cannot be open, but maybe there is always a way to open a window. And when there is possible as well, keeping the children outside on certain activities. And I'm sure that we can, if you have a look as well at the Q&A, you will have plenty of responses. Going back to my group, they will be providing the best of the expertise on engineering solutions for ventilation, technical responses to the questions that for which we need to provide answers. And as I say, it's composed by architects, by environmentalists, by public health officers, by engineers, and this is by these different specialities talking together and exchanging that we can provide hopefully the best of the technical expertise and recommendations.
Thank you. We have a question from LinkedIn, and we've had this a few other times as well as I scroll through the questions here, on air purifiers. So that's different from air conditioners, or they're not necessarily changing the temperature of the air, neither heating it nor cooling it. But Luca, if you could help us understand, are air purifiers useful?
Yeah, sure. So first, to be effective, standing alone air cleaners, or often called air purifier, with particle filter should be operated continuously. Okay, if there is only one, it should be placed in an area where most of the people in the household spend their time, and should be selected one with high efficiency media filter with such MERVs 14 or higher, and have a high clean air delivery rate. However, by itself, a portable air cleaner or purifier is not enough to protect people from COVID-19. When used along with other best practice recommended by WHO, operating an air cleaner can be part of a plan to protect the family.
And I think just to reemphasize what Dr. Nera had said earlier as well, that the throwing open the windows, if you can, is better than any piece of machinery you can have. People are wondering, we had a question earlier on, somebody wondering, as a grandparent, what can they do when they're visiting their kids, their grandchildren? How can they make the environment safe when they're going somewhere else, when you don't control the environment around you? And I think that might be when we use the other tools we have on hand, which is trying to keep the distance, although that's hard if you want to hug those little kids. Wearing the masks, WHO recommends them, especially for people who are over 60, to wear masks when people are out and about, and the hand washing as much as possible. We're going to wrap up, but I wanted to summarize name a few of the countries where people have been watching us today. On Facebook, we've had people from Philippines, Indonesia, Northern Ireland, India, Tajikistan, Cambodia, Colombia, Nigeria, Nepal, Uzbekistan, Vietnam, Turkey, Bangladesh. We've also had from Algeria, Liberia, Bosnia, Albania, Switzerland, where we are, Uruguay, Pakistan, Tajikistan, Canada, Ghana, Germany, Japan, Zimbabwe. Thank you all very much for watching today. I actually guess one more chance though. Luca, when you're speaking with people these days and they find out your specialty, what's the main thing they ask you and what's your main answer to them?
So the main question is today, when people meet me, is what we can do now that the winter is coming. How can we open the window? And what I usually answer is that if you have an heating, ventilation, air conditioning system in your house, you can check. You find all the recommendation in WHO website and other institutions that are specialized in ventilation system. You can check, you can improve your ventilation either through mechanical or natural ventilation, and then please try to apply all the other recommended measures to stay safe and protect you and yourself and your family.
And thank you very much, Luca. And Dr. Nera, you've already spoken a little bit about this, and you can even repeat it if you wish, but tell us about how this small positive that could come out of COVID-19, which is the building back better and thinking better and safer for the future. What is one of the things of positive that you already see coming forward?
Well, Nika, thanks for the opportunity. You know, we need to reestablish our relationship with nature. Nature is the main source of human health. They provide the air we breathe, the food we eat, and the water we drink. So we need to stop destroying the environment, because that is contributing as well at what we are suffering now, increase the risk of infectious diseases. And then We need to tackle the causes of pollution, air pollution, because that is making us as well very vulnerable to the spread of any respiratory infectious agent. And you can see that we are increasing the vulnerability of the people living in very polluted cities. Their lungs are already more vulnerable than those living in cities that are not so polluted. So we need to tackle the causes of air pollution. We need to reduce air pollution, and that will be contributing to a safer, greener, and healthier future for all of us.
Thank you, Dr. Marianera. Thank you, Luca Fontana. Thank you for watching. If you want to watch this again, you came in early. This whole show will be available again on the platform wherever you're watching us now. My name is Nika Alexander. Please tune again for the next time we have another live. Have a good day.